Welcome to the deep dive.
Yeah.
Today, we're really getting into the nitty-gritty, looking at global regulations for managing a couple of, well, really nasty workplace toxins,
Yeah.
asbestos and lead.
Right. We're moving past just saying they're dangerous.
Yeah.
We're digging into the actual systems, the controls, the protocols that are required by bodies like the ILO.
So what's the mission then, really?
It's about pulling out the core knowledge from these dense regulations, understanding the sheer level of detail needed to protect people when these things are just part of the job site.
Okay. And we've got some pretty heavy source material here, regulatory excerpts talking about health checks, exposure controls, how you actually handle this stuff.
Exactly. This is the practical side. Systematic risk management, learn the hard way over, decades.
Right. Let's start with asbestos. Everyone knows it's bad, right?
Mm-hmm.
But maybe not like a generic term for different mineral fibers.
Mm-hmm. Naturally occurring. You often hear them called by color. Chrysotolite is blue, amosite brown, chrysotile white.
But the sources warn us. You can't just look at, say, an old ceiling tile and know for sure what type it is, can you? The color name doesn't always match the appearance in the actual material.
No, absolutely not. That blue asbestos might not look blue at all once it's mixed into something. You need proper lab analysis, technical analysis, to be certain what you're dealing with.
And they're all dangerous if inhaled.
Critically dangerous. And the real kicker is the delay, the symptoms. They can take decades to show up. People might not even know they've been exposed until it's far too late.
Okay, let's walk through those health effects. Because that delay, that latency, it explains why the rules are so strict.
First up is asbestosis. Basically, when you breathe in these sharp fibers, they get stuck deep in your lungs, in the alveoli. Your body tries to fight them, creates inflammation.
Yeah, scar tissue.
Exactly. Scar tissue, fibrosis, the doctors call it. It makes the lungs stiff, less elastic, harder to breathe. And the symptoms, breathlessness, coughing, chest pain, they often don't start for maybe 10, even 15 years after exposure began.
Wow. 10 to 15 years. And that's not even the worst outcome. What about mesothelioma? The latency there is even longer, isn't it?
Much longer. Mesothelioma, that's a really aggressive cancer of the lining around the lungs, the pleura. Symptoms often wait 30, maybe even 40 years.
40 years.
Yeah. The fibers can kind of migrate through the lung tissue and affect nearby areas. Then there's lung cancer. The risk for an asbestos worker is about 10 times higher than for the general public. And pleural thickening, where the lung lining thickens up, again, making breathing difficult.
And we have to stress, even though its use was banned in many places, like the UK back in '99.
It's still everywhere.
Absolutely everywhere. In buildings people work in every single day. It's a huge legacy problem.
Mm-hmm. Construction, maintenance workers, they face it constantly.
You find it in old corrugated roofs, ceiling tiles, vinyl flooring, pipe lagging, even decorative plaster like Artex sometimes. Old brake linings, too.
Right. And if someone is exposed, we have to mention the synergistic effect, the combination with smoking.
Ah, yes, the synergistic shock factor, as the sources put it.
Yeah.
That statistic is just horrifying.
It really is. 90 to 1. An asbestos worker who smokes has a 90 times higher risk of lung cancer compared to someone who doesn't smoke and isn't exposed to asbestos.
90 times?
It's almost unbelievable. And that's why employers must inform workers about this specific amplified risk. It's a required part of the training. It's not optional.
Okay, so given that level of risk, if you can't just get rid of the asbestos entirely, how do the regulations like the ILO Code of Practice say you control it? It's all about a hierarchy, starting at the top.
Exactly. Prevention is the goal. So the absolute first step, the best option, is replacement. Can you swap out the asbestos-containing material, the ACM, for something safe, or at least something less harmful? That's always priority one.
Makes sense. Get rid of the source of the problem. But if you can't replace it,
then you move down the hierarchy to engineering controls. These are physical changes to the workplace or the process itself to, contain the hazard.
like what specifically?
Things like enclosing the process, maybe automating parts of it so people aren't directly involved, wetting down materials, bonding the fibers with water or other substances to stop dust getting airborne.
Right, keep the dust down.
And crucial is local exhaust ventilation, or LEV. Systems designed to suck the dust away right where it's being created before it spreads.
And these LEV systems need careful management.
Oh, absolutely. The sources are very clear.
Mm.
You can't just install LEV and forget it. It needs regular checks, performance testing, strict maintenance to make sure it's working effectively all the time.
Okay. And for really high-risk jobs, like removing a lot of asbestos during demolition?
That's when you get into total enclosure. Basically, building a sealed containment around the work area, often called a tent or enclosure, and critically, it has to operate under negative pressure.
Negative pressure, why is that so important?
It means air is constantly being pulled into the enclosure from outside through filters. So if there's any tiny leak, air flows in, not out. Dust can't escape into the surrounding area.
Gotcha. So it contains everything.
Precisely. Workers go in and out through an airlock system, and they must decontaminate properly when they leave. You also need good general ventilation supplying clean air, filtering the exhaust air very thoroughly, and usually you don't recirculate that exhaust air back into the workplace unless you have extremely reliable filtering and monitoring.
The regs also talk about administrative stuff like needing a written plan.
Yes, a formal written control program. Every employer needs one. And it's not just a tick box exercise. It has to detail the actual processes, the machinery, estimate how many workers might be exposed, list the specific controls being used, who's responsible for what, and have a clear schedule for implementation and review. It's the safety blueprint.
So engineering controls are key, but sometimes
Yeah,
you still need personal protection, right?
you do. But it's vital to understand respiratory protective equipment, RPE, like masks, is the last resort. It's not a replacement for good engineering controls.
It's for specific situations.
Exactly. Temporary tasks, emergencies, maintenance work, or if, despite other controls, exposure limits might still be exceeded. It supplements the other controls, it doesn't substitute for them.
And the employer has to provide this.
Yes, free of charge. They also have to make sure workers are trained properly on how to use it, how to check it fits, how to maintain it, and it needs regular inspection itself.
Makes sense. And protective clothing, too. Needs to cover everything.
Completely cover all personal clothing, head covering included. But the rules around decontamination, getting clean after the work, that's where you really see how seriously this is taken. The risk of taking fibers home.
Yeah, tell us about that. It sounds quite involved.
It is. The hygiene setups are very specific. You need completely separate locker rooms for your clean street clothes and your potentially contaminated work clothes.
Two separate areas.
Right. And often, vacuum cleaners are provided right at the entrance to the dirty changing area, so workers can vacuum down their outer layer before even taking it off.
Okay, and then?
Then, crucially, there must be showers or wash facilities between the dirty locker room and the clean one.
Ah, so the shower is the barrier.
It's the physical boundary. You leave the contaminated gear in the dirty area, you shower completely, and only then do you enter the clean area to put on your own clothes.
And the work clothes themselves. Can't just take them home to wash.
Absolutely not. Strictly forbidden. Think about it. You risk contaminating your home, washing machine, other clothes, your family. The employer must provide proper laundering facilities that know how to handle asbestos-contaminated clothing safely.
That single rule, don't wash it at home, really says it all about how pervasive and dangerous these invisible fibers are.
It does, and similar rules apply to handling the waste. It has to be sealed in impermeable bags or containers, clearly labeled with warnings, stored properly, protected from damage, and disposal has to be at an approved site, one licensed to take asbestos waste. Employers need to check the site as suitable and often supervise the disposal contractor.
Okay, so that's asbestos, focus on containment, engineering, air monitoring, strict hygiene. But now let's switch gears to LEED. The approach to monitoring seems, well, quite different.
It is quite different, yeah. LEED's a heavy metal, toxic, particularly damaging to the central nervous system. You find it in mining, smelting, batteries, pigments, ammunition, lots of places.
And exposure is often breathing in fume or dust, like asbestos.
Often, yes, inhalation is a key route, but lead gets absorbed by the body differently, and that changes how we monitor the risk.
So what's the main difference in the regulatory approach? Let's use the UK SEAL law regulations as an example.
The big shift is towards statutory biological monitoring. This means regularly taking blood or urine samples from workers who have significant exposure.
So you're measuring the lead inside the person, not just in the air.
Exactly. We're tracking the actual absorption. Now, this doesn't replace checking the air quality or the effectiveness of controls.
It's in addition to environmental monitoring.
Absolutely. It's another layer, a check to see if the controls are truly working and preventing absorption. The regs define when this biological monitoring is needed based on a significant risk.
Which means?
It's triggered if exposure is likely over half the legal limit, or if there's a real risk of swallowing lead, maybe through contaminated hands, or if workers handle lead compounds that can be absorbed through the skin. If those conditions exist, biological monitoring kicks in.
And unlike asbestos, where the disease takes decades, with lead, the regulations set specific numerical thresholds for action based on those biological tests.
That's the key difference. Because lead absorption can be measured relatively quickly, the system uses clear limit values. There's an action level.
Okay, action level. What happens then?
If a worker's blood or urine lead level goes above the action level, the employer must take steps immediately. Review the controls, check work practices, maybe provide more training, find out why exposure is happening, and reduce it.
And if their level goes even higher?
Then you hit the suspension level. If a worker's level exceeds this higher threshold, and the appointed doctor agrees, the employer must remove that person from any further exposure to lead.
Medically suspend them from lead work.
Right. It's a protective measure to stop more absorption and allow the body's lead levels to fall before serious, potentially irreversible health damage occurs. It gives clear, quantifiable intervention points.
So tying these two hazards together, the common element is health surveillance checking if the controls are working. For asbestos, it's long-term checks because of the latency. For lead, it's the specific biological monitoring we just talked about.
Correct. Both systems use health surveillance to verify protection, and importantly, both frameworks recognize that some groups need extra protection.
Ah, yes, the regulations mention specific requirements for certain groups.
There's a general principle that you need different, often stricter levels of protection for young persons and for women of reproductive capability.
And the lid regulations, CLIW, they actually put numbers on that.
They do. This really highlights how far the protection has to go. Under SEAL law, there are significantly lower action and suspension levels specifically for women of reproductive capability.
Which is defined quite broadly.
Yes, basically any woman physically capable of becoming pregnant. And also for young persons, defined as 16 or 17-year-olds, the science shows these groups can be more vulnerable to LEEDS effects, so the trigger points for action are set lower to provide that extra margin of safety.
That requires a really detailed risk assessment, doesn't it, considering the specific workforce?
It does. And underpinning all of this, for both asbestos and lead, is training. Effective training is absolutely essential.
Not just for the workers handling this stuff.
No, everyone. Workers need to know the sources, the health risks, especially that smoking combination for asbestos, and exactly how to use the controls and PPE. But managers, supervisors, safety professionals, they need that training too, so they understand the requirements and can enforce them properly.
And sometimes competence checks are needed too, like licensing for asbestos removal.
Yes. Particularly for high-risk asbestos work, you often need licensed contractors, people who've proven they have the knowledge, equipment, and procedures to do the job safely. You just can't risk having untrained people dealing with something that can cause fatal disease 40 years down the line. #tag outro. So looking back at this deep dive, it really shows that managing asbestos and lead isn't a one-off task. It demands constant vigilance, acknowledging those incredibly long latency periods for asbestos.
30, 40 years from mesothelioma.
Exactly. And having those clear, measurable boundaries like the action and suspension levels for lead, it's about building this robust system of protection.
A fortress of safety, almost, with multiple layers.
Planning, precision, consistent application.
Yeah. And when you think about those asbestos decontamination rules, the negative pressure, the separate showers, banning washing work clothes at home, it really drives home how vital it is to stop workers carrying these invisible threats back to their families.
It's about breaking that chain of transmission completely.
Absolutely. So maybe a final thought for you, the listener. Considering the LEED rules, what does that specific inclusion of lower limits for women of reproductive capacity and young people tell us about the responsibility of regulators? How far do they need to go to protect not just current workers, but potentially future generations too from these kinds of hazards? Something to think about. Thanks for joining us for the deep dive.